Afro-descent women and gender-expansive persons lose their lives to preventable killers globally. Our quest for health equity is a tale of oppression, poverty, exclusion, and state-driven violence. It is also a tale of regimes of activism, organizing, and women-led programming for inclusive health futures. Through this tale, we learned that the challenges impeding our equitable benefits from health services and policies bear significant similarities and know no boundaries. Here are a few constructs to show this. Globally, millions of women are in the lowest paid work, earning 24% less than men. In developing regions, mainly Sub-Saharan Africa, Latin America, and the Caribbean, 75% of women are in the informal economy with limited legal rights or protection. This means that millions of us lack financial autonomy and earn less to escape poverty or boost our ability to demand and spend on healthcare. More than other categories, African, Afro-descent, and gender-expansive persons bear the disproportionate brunt of global health pandemics. We looked at the case of maternal health and non-communicable diseases. In the United States, infants born to African American women are 1.5 to 3 times more likely to die than infants born to women of other races or ethnicities. In Latin America and the Caribbean, while maternal mortality fell from 88 per 100,000 live births in 2005 to 74 in 2017, several countries in the region still have a ratio above the target 3.1 of the Sustainable Development Goals. Similarly, in the United Kingdom, Black women are reported to be 5 times more likely than white women to die from complications in their pregnancy. In 2017, Sub-Saharan Africa accounted for 2/3 of the world's maternal deaths. Globally, non-communicable diseases including neurological conditions, cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, and mental health needs claim the lives of up to 16.8 million women. In a 2019 continent-wide study, the African Women's Development Fund found that over 300 million African women were directly affected by NCDs with a double caretaking burden. Compared to their white British peers, Black women living in the UK are reported as having poor prognosis and more significant morbidity from treatable and preventable health conditions like diabetes, cervical cancer, and heart disease. State-driven violence, anti-blackness, trans and homophobia perpetuate environments of terror and systemic exclusion of women from accessing comprehensive health care and living a life of dignity. In 2019, the Human Rights Campaign reported that at least 25 transgender or gender non-conforming people were murdered by violent means. 91% of these were Black women, 81% under the age of 30, and 68% lived in the southern region of the US. Still, in 2019, the tolerance level for coexistence with LGBTQ+ individuals or communities ranged from 3% in Senegal to 26% in Swaziland in a 33-country study on the African continent. In Brazil, Black transgender women are more likely to be victims of violence. Yet, we still dare to challenge, as individuals or collectively, African, Afro-descent women and gender-expansive persons have remained committed to leading the activism, organizing, and action that seeks to address these barriers. Crystal Simoni is an African feminist using the Nawi Collective to build a community that analyzes macroeconomic policy and programming using a feminist lens. Challenging exclusionary macroeconomic politics has the potential to position women as critical drivers of the health equity agenda. Kia Brown is an African-American activist and author of The Pretty One on life, pop culture, disability, and other reasons to fall in love with me. She uses social media to advocate for body positivity among African American women living with disability by sharing her experiences about living with cerebral palsy. The Silent Majority Ghana is a group of Ghanaian feminists and LGBTQ people who coordinate raise awareness, and supports women and LGBTQ people's local and global efforts to create a safe society free from discrimination and violence. Maria Fernanda Arboleda is an Afro-Colombian transgender woman and activist. They are a community agent with Heartland Alliance International, an organization that works to secure the rights of marginalized groups, including the LGBTQ+ community. Arboleda delivers mental health and legal services for communities impacted by internal conflict. Marielle Franco was a Black Brazilian human rights activist and city councilwoman who advocated for Rio de Janeiro's poor Black slum communities. Inspired by her outstanding work, her murder in 2018 sparked a rise in Black women's political participation in Brazil. Afro-Brazilian women won 14% of city council seats nationwide in 2020 from 3.9% of city council seats in 2016. Agnes Mwakatuma co-founded Black Minds Matter to provide free therapy to Black Britons who cannot afford quality mental health services. As a mental health support worker herself, she hopes to address the structural racism that affects the healthcare system in the UK. Leading from the South is an example of a Global South financing partnership to transform power, capacity, and resourcing for women's rights organizations in Africa, Asia, and the Americas. It is hosted by 4 Global South Women's Funds, namely the African Women's Development Fund, Fondo Mujeres del Sur, International Indigenous Women's Forum, and Women's Fund Asia, committed to advancing policies, organizing, and dignity for marginalized women. In the courage and leadership of these and many women before and among us, we are inspired. We are also reminded of how enormous and critical yet under-resourced our cut-out work is. We invite us all to continue pushing this change together.